my friend pen, write simple prose and sweet.
Hello everyone, I'm Dr. Christopher Hung Vu, and our show is Future Healthcare A to Z. The topic of discussion for us tonight is integrative medicine in primary care. And to help me with the discussion, I have the pleasure of having Dr. Francisco Kim,
Hello.
an acupuncturist from Korea, and the live audience. So let's talk about integrative. What is integrative medicine? Integrative medicine is the practice that integrates all the resources that are available to us that we may not be aware of, but are very real. Dr. Kim is a specialist in acupuncture, and he has his training and education in Korea and in LA. Let's talk about the first thing first. Now, sometimes some of the resources that we don't think of can be very helpful. For example, just the thoughts we have, the positive thinking we have. Every morning when I flip on the internet and check out CNN, 9 out of 10 news items are negative. Ukraine crisis, the problem with healthcare, all the negative news. So why don't we think about something more happy? Put on the best clothes that you have every morning when you get up, just to look good, make you feel good, and have a positive thought about what you're going to spend today talking to your family or going to work. And because we're talking about acupuncture, I want to ask Dr. Kim, it amazes me that during the past year or so, we've seen so many patients who come in who are desperate. They spend days on ends in the hospital, in the emergency room, and they're not happy because they feel that the care that they received did not help them. So what do you do to really effectively help them in the office?
For the musculoskeletal patients, we give them some manipulations or acupuncture, herbal medicine,
Pain management, right?
pain management, and for the mental or psychological problems, we give them some different type of remedies like meditation and breathing technique and Tai Chi besides the acupuncture.
Okay.
So basically we are integrating any resources that will help the patient's condition.
Yeah. You know, it's amazing that I understand that up to like 70%, 80% of the chest pain that go to the emergency room are not cardiac origin. They are all psychological, psychosomatic. And the way they manage is that's totally inefficient and inappropriate. They may have tests, they may have procedures that they don't need, and not helpful. So that's the first thing that we need to do is that to find out the different pathways, right? The pathways to help them that doesn't cost nearly as much. Now tell me about why do you think that acupuncture is working?
First of all, it has been developed and been practicing throughout last maybe 2,000 years in East Asian.
5,000 years.
5,000 years in Asian countries. So they have better knowledge about how to deal with each symptoms, and they understood how those body reacts and then functions of those.
Tell me about the meridians.
Meridian was that concept. It was developed by those ancient East Asian practitioners, but nowadays they are more going into detail, like some of the muscle fascia, and even under the microscope there are some other things that we think is meridian, but I would say it's very functional thing that God gave us.
What I found out is very fascinating is that a patient can come in with a chief complaint of runny nose or headache, and you put a needle in their foot and it helps their symptoms. And that is because the meridian is working. I mean, it stimulates something in the toe, and then the electrical stimulation or the release of endorphin helps the headache, right? So that is something that is totally unknown in the way we practice medicine in the Western conventional way. Now the other thing is that I have found out that just by helping them relieving the anxiety, the stress that worries them for whatever reason, a practitioner with true concern and interest in the problems is already healing, starting the first minute, right? I mean, you come in and you talk to them. And the problem is that the way we practice in the emergency room or whatever I see every day, the doctor's always busy, right? They always are thinking of something. And they don't communicate with the patient, don't you think? I don't think I'm going to go to see the doctor. They don't understand what I'm coming for. They're just busy or doing something else. And that to me is very disturbing because you have to really spend time, quality time, to understand the patient's problems. Then you can help them, right? So he told me that acupuncture can be practiced mechanically, or you can do that with true concern for the patient, and that makes a difference, right? You tell me about it.
Yeah, nowadays those specialists, scholars in Korea or China, thinking that the reaction to certain acupuncture point stimulation is caused by the mutual communication between the patient and the practitioner. So if the patient doesn't pay attention or they shut down their mind on any kind of a procedure, then the effect will go down. Some people might say it's a placebo, but it's the way it is. As long as we are awake in terms of our mind works.
Yeah. Now, pain management is a major routine treatment in the office every day, right? And we have drugs. We have Tylenol. We have aspirin. We have codeine. But all those drugs can have side effects, right? It can have tremendous problems. I mean, you have 10 benefits. You have 8 side effects. Now, what is to me is amazing about acupuncture is that it's with a small stimulation of with the needles, which is totally harmless. I have seen with my own eyes that you can relieve the patient's acute or even chronic pain within 2 or 3 sessions. To me, it's amazing. Why don't we do more of that? I mean, it costs so much less.
Yeah, luckily, Governor of California included acupuncture as essential health benefit last year. So all the Californians, if they have their OBAMACARE, then they are covered 100%.
Okay. Yeah. Hopefully, they will seek the less costly treatment that is effective. I mean, one of the things that we can do, I mean, I'm trying to remind everybody who's present here today is eat the right foods. Do you read the labels of the foods when you buy them? Do you? You should. You should finalize the nutritional quality of the food you eat. The food is like gas you put in the car. I mean, if you don't eat the right food, you're going to be sick, right? So it's a very important part that we can do without having insurance or healthcare or money. You can do a very simple thing. I have Mr. Sean Lee here. He's a trainer for breathing technique, right? I mean meditation, breathing. Just by breathing the right way, we can maintain our health. We don't get sick as often, right? And keep the posture. Sometimes I forget to sit straight. Just sit straight and then breathe the right way with your diaphragm. Can help you a lot. So those things we can do every day. Everybody can do that, right? But we don't do it. I have here a friend that came from LA. I'm very pleased to give her the microphone so I can talk to her. Her name is Mihai. She's Vietnamese. And her passion is to give care to people with various problems. And she has helped quite a few of them. Just tell me about a few patients that you actually helped in the past 6 months.
Oh, hi. My name is Han. I'm a healer from Westminster, Southern California. What I do as a healer is that I use very effective products made in the US and Germany. I use them on the sick person's chakra and reflexology points. The best tool that everybody like would be this one. It's called
Beamer, right? Beamer?
It's called Urteichenstrahler in German.
It's made in Germany.
It's made in Germany. And the English translation is primary particle beamer. So we have to use it 1 to 3 centimeters from wherever we want to treat. And I got success with a girl who has melanoma, stage 1. One time I put this on not the main melanoma, but it was spread into 2 parts of her body. So I put this in the part which was spread, the melanoma spread too, and she said she feel tingle in the main mole. And I spent 16 hours with her altogether.
Put it back.
Oh, I'm sorry. I spent 16 hours with her altogether, and the melanoma was gone.
Yeah, the Western doctors will not believe you. They say that you are just doing that and something happened that has nothing to do with what you do. But I have an explanation for that. I think that has to do with the energy transferring. I have learned that from Dr. Kim, my friend here, and from a teacher of Qigong, that we have sources of energy that is running in our body, and you can feel the flow of energy one place to another. And by transferring the positive energy to the area that has negative views, you can help improving your health a lot. I have learned how to breathe correctly, that I can recover from very severe fatigue and weakness after a very short period of time. So there are ways we can help ourselves, and we're not using it. We have to, get the MRIs and CT scans and the hospitalization that costs thousands and thousands of dollars. And it's not the way to do it. Now we live in the Silicon Valley, which to me is the crown jewel of the world. Why? Because we have all the abundant natural resources. We have Google, we have Facebook, we have Twitter, we have IBM, we have HP. We have all the great companies here. And why we don't have ways to do things that are better for medicine? The main key to success of healthcare or anything else is education, right? We need to be educated about the ways to maintain our health, to prevent sickness, and to heal. And we don't have to spend so much money for those things to succeed. Now, I'd like to ask Daisy to read a short essay on the way things are now, happening right now. And then Cassandra will read an essay called the Dream Vision. Okay, go.
The way it is, year 2014, Los Angeles, California. Cars clog up highways, causing many traffic jams and accidents. Air pollution increases every day, worsening the ozone thinning effect. Drinking water is contaminated. People buy foods without knowing the nutritional value of what they buy. Alcohol and cigarette consumption remains high, despite the many warnings about its poor effect on health. Most city dwellers simply do not have the time nor the energy to exercise. They would rather slouch in front of the TV, gobbling junk foods. Houses are expensive, energy inefficient. They are built on empty lots to form sterile neighborhoods. Open space, already scarce, is being replaced by cheap condos. There is no good preventive medical service. The quality of medical care is poor, despite the ever-increasing health insurance premium. Care providers are medical technologists with no interest nor ability in health education. Alternative medicine continues to be reduced. The cardiac cath lab at the hospital is the biggest money-making machine for the institution. Many high-tech procedures are performed every day as heart attacks continue to be the #1 killing disease. The number of patients dying of cancer also increases. The dirt continues to be manipulated to make money. Cosmetic surgery is a boom. Many patients do not want to pay anything for care when they are sick, have no problem paying for cash for any number of cosmetic procedures. Many lawyers are hungry and are eager to find the opportunity to create a lawsuit. Many patients with a significant chronic illness cannot afford to buy any health insurance. The main service in medicine is episodic stress-related illness at exorbitant prices. The new magazine stands and internet websites are flooded with wordless, empty literature. The air is bombarded with nerve-jamming music and trash videos. Crime is the way it has always been. It reflects the lack of role models in a community where cold cash is the main value. Church and temple attendance is poor. People have too little time to worship. Many teenagers would rather hang out in the theaters and coffee houses than spending time in the classrooms. The healthcare expenditure continues to rise and currently is at 17.5% of the gross domestic product. It will even be worse than 40 million more patients are enrolled into the system, as mandatory health insurance coverage is imposed.
Okay, let's have a dream vision of what's going to happen.
The dream vision. Year 2045. Village Green. A few cars and buses are electrically run for public transportation only. People ride their bicycles to work. Air pollution is maximally controlled. Drinking water is filtered and purified. In agriculture, minimal amounts of pesticides are used to avoid soil contamination. The growth of grains and produce is carefully planned to minimize soil battering and to optimize the production. The main source of protein is soybean and occasional baked fish. There is no meat consumption. The village inhabitants exercise routinely in and outdoors. Urban planning is well thought out to provide efficient family dwellings and lots of open space for community recreation and social gathering. Preventive medical care is accepted and practiced universally free of charge. Care providers become healers and teachers. Alternative medicine becomes mainstream. As public health measures are prioritized, infections are rare and readily controlled. STD becomes sexual treat to delight. HIV is honor in the vows. In an environment of peaceful coexistence with no smoking, alcohol, high-fat foods, cardiovascular diseases become rare, and most high-tech interventions become obsolete. A few patients with incurable cancers die at home under hospice care. Most people die naturally of old age. Their death is no longer medicalized or legalized. The village inhabitants are comfortable with themselves and plastic surgeons repair defects and congenital of traumatic nature only. Many lawyers become counselors, writers, and architects. The group of citizens at high risk of developing organic diseases such as diabetic mellitus, arthritis, and other hereditary conditions receive comprehensive education to become independent and productive. Occasional, unavoidable sicknesses and accidents are quickly treated. Everyone receives training to attain health glow, which is their optimal health. Literature, poetry, the fine arts, easy listening, music flourish. Crime is minimal, and sentences include planting trees and growing flowers in public parks. Church and temple attendance increase geometrically. Children love their teachers and their classrooms. They share the chores of keeping them clean and tidy. The healthcare expenditure is 4% of the gross domestic product. 14% is spent on education. The politicians stop squabbling about the balancing the budget.
Okay, let's talk about stress. Most of the people that I see in my practice are coming with the stress-related or stress-induced symptoms. What is your take on that? What is your experience with this common problem?
Yeah, when we get stressed, we are more sensitive to the pain. So when I treat any patients, I treat them not just their pain, but also their stress level, which is the mind. So I'm very interested in mind-body medicine or functional medicine, so that they can maintain. I mean, I teach them, I train them how to maintain their peace of mind, and so that they are more. They can better they can handle better with their stress or the pain. And especially these days, even the kids, they have their own handheld computers or game devices, and they have more and more neck and shoulder and then TMJ injuries. So and also it causes a lot of stress. So we have to kind of keep our eye on that, and we need to train more people, not just the physician, but like you said, some other assistants can do that. Then that way this integrative medicine can be included in the mainstream.
It's amazing to me that sometimes just doing very simple, easy things to do, like you don't want to own too many things. I mean, when you own too many things, you have to take care of them. I don't understand how people can have 4 or 5 houses, big houses. I mean, they have to take care of them. And that causes a lot of stress. I mean, they have tremendous mortgages, and they have money worries. I mean, those are the things we'll talk about when they come to see us, because they come in because they have headache, they have chest pain, they have runny nose, they have coughs, but deep inside they worry about their money, and they worry about not having time to do what they want to do. So those are the things that to me are very important. People should have a hobby, for example. I have a hobby. I love listening to music, and music helps me relieving the stress and the tension, and it's available. You just turn on YouTube. You have zillions of videos. I mean, of very high quality for free, and that helps me maintain my health and staying from having stress. Those are the things you can do every day. You don't have to go to the emergency room. And Dr. Kim and I are trying to find a way to help people understand that doing very simple, like eat the right foods, just talk to the next person around you. I mean, talk to your wife, talk to your husband, talk to your family about the things that in their mind. We don't have communication anymore among ourselves. And that causes stress. I mean, because we share the same concern, really. You know, I mean, we want to have a happy life, we want to have less stress. But we run to the job, you know, to make money and buy things and everything else. So anyway, we're running out of time. I hope that I don't, I don't mean to preach, but I just want to suggest a few things, very simple things that can help us stay away from the doctors. We say that, you know, we eat a apple or banana one daily to stay away from the doctors. Maybe you can listen to a piece of music, you know. Maybe you can look at something very pretty, and that gives us a positive source of energy. Then we don't have to spend so much money in buying drugs and seeing the doctors, having procedures. Okay? So anyway, I hope that this has been somewhat entertaining for you. And I appreciate your presence here today to participate in the production. I'd like to extend my warm thanks to the production staff of KMVT in Mountain View. And our show will be broadcast locally and also on YouTube and on our website, futurehealthcare.a2z.org. Again, I'm Dr. Hung Vu, Christopher Hung Vu. Our show is Future Healthcare A2Z. Good night. Thank you for watching.
My friend Pen, write simple prose and sweet poetry, expresses joy and sorrow, hope and fear.